Hey everybody, welcome to Investing in Your Health. My name's Chris Steele, and we're going to be talking about investing in your biggest asset, which is your health. Our expert guest today is Dr. Lesley Milton. She's a pediatric dentist and owner of Tooth Be Told Dentistry. And before we get started, I want to thank First Community Bank for giving us the opportunity to talk to you guys today. So just a little about our expert today. Dr. Milton trained in dentistry in Geisinger Institution, which is in Pennsylvania, very close to where I trained in anesthesia, and so we're kind of close there. She was a graduate of Lyon College in Batesville, Arkansas, and also did a fellowship in pediatric dentistry. So she's been running her own practice very successfully in Batesville now for a few years, and doing an awesome job here. And Lesley, do you want to tell us a little bit more about yourself?
Sure. Thanks for having me today. Originally, I was born and raised in Wynne, Arkansas, so about an hour and 15 minutes from here. Like you said, I did do my undergrad training here at Lyon College in Batesville, so that's how I became familiar with the area. Once I finished up dental training in Memphis and my pediatric training in Pennsylvania, I married my husband, Drew Williams. We moved back to the area, opened up Tooth Be Told. We have a dog, an Aussie Doodle named Otis. He is the future therapy dog of Tooth Be Told, so that's coming this year. And in my free time, I have 3 horses, Hot Rod, Hollywood, and Famous. I like to barrel race and just anything outdoors.
Wow, that's fun. Wynne, Arkansas, you know, I ran a marathon, my first one in Wynne, Arkansas. It was absolutely miserable, let me tell you.
You were probably out running the mosquitoes there.
Yeah, well, there was like one, it was pretty flat, there was one speed bump that felt like I was climbing Mount Everest, but other than that, it was okay. So anyway, lots of fun to be had. So what's the difference between a pediatric dentist and a traditional dentist that we hear about?
Okay, so a pediatric dentist is essentially, it's equivalent to the pediatrician of dentistry. So you complete 4 years of general dental training. After that, a pediatric dentist goes on to 2 additional years. This is really, you know, the time that we focus on infant care, all the way children's to adolescents and special health care needs. And then also we get 2 intense years of hospital dentistry, sedation dentistry, orthodontics, trauma cases. I still have nightmares of my beeper going off in the middle of the night, dental trauma cases. So it's just two more years of advanced training handling pediatrics.
Well, great. I know you've made a lot of changes to your clinics lately for your patients and their safety. Can you tell us a few things about what y'all are doing?
So we've been following the CDC and the State Board of Dentistry guidelines very, very closely. We've set up where we screen, you know, not only the staff that I still have working for me, but the children as they come to the clinic for emergency cases. They've limited us to only emergent cases, meaning pain, dental abscess, trauma, anything to try to take the burden off the hospital for those cases. So once the parent gets to the parking lot, we have been having them call us. If the child is school age, then we request that they just come in the building and facility just to cut down on the amount of people in and out, obviously washing our hands, taking the child's temperature. Dentists have always had a pretty strict PPE infection control process, so we're wearing our N95 mask, our gowns. My hygienist and I have been, you know, throwing all that away and even bringing an extra change of clothes so that we're not taking it outside of the facility once we see the emergent cases.
Yeah, well, it sounds like y'all are doing a whole lot regarding that. So, a lot of people are home more, obviously, with a lot of people working from home, a lot of kids out of school. What are some things people can do for their basic dentistry needs during the day since they have a little bit more time at home?
So a couple things. Dental cavities, caries is the most common chronic childhood disease. So it's 5 times more common than asthma and 7 times more common than hay fever.
Wow.
So not getting out of the routine of brushing, you really need to be brushing twice a day, flossing once daily. Another thing with the kids being home, limiting the sugary drinks and snacks. Trying to limit those. I know the kids are home, they're getting restless, that's all they want to do is drink juice and soda all throughout the day. But
and by limiting, do you mean have at least 1 hour where they're not drinking juice and eating snacks? Is that the limit you're referring
Maybe
to?
more than 1 hour.
More than 1 hour, okay. I'll have to tell my kids.
It's all about frequency. So the American Academy of Pediatric Dentistry, they recommend, so the amount of juice that a child should get, less than 1 year, there's no nutritional value to that. So not sending your kid at that age to bed with juice, and then 1 to 3, the recommendation is 4 ounces. So that's a day. So,
and
a
one
lot
of those
of kids,
small juice boxes?
one of those small juice boxes. But we say having it all at one time versus waking up at 7 o'clock in the morning and drinking it all through the day. It takes your mouth about 30 minutes to recover every time you drink something sugary or acidic. So as you can imagine, if a child is drinking all through the day, they're much more likely to have, be prone to the cavity process speeding up or developing a cavity.
So don't have them nurse their drink the whole day. If they're going to drink juice, have them drink it and be done with it.
And be done with it. So I always tell all the parents and families that come in, have it at meal or snack time. Now the sugary snacks or carbohydrates that we're having in our diet, I always tell parents, the general rule that I follow, if you chew it up and you look in the mirror and it's all in the grooves of your teeth, something like sticky candies or chips, cookies, maybe just brush it out of there so it's not sitting on the teeth all throughout the day. And then at nighttime, when you get ready in your routine to brush, get everything off the teeth and no more juice and no more snacks after that at nighttime. And that can help prevent the cavity process.
That's really helpful. I really appreciate that. Those are definitely things to know. Are there some habits that people get into sometimes while they're at home for adults, perhaps? I know those are some tips for kids. Anything adults can
For adults as well, I always, when I'm talking to the parents, equivalent to if you're working a job and say you're drinking a diet soda or a Coke all throughout the day, much more likely, that acid, that sugar is sitting on your teeth all through the day, so you're speeding up the process of cavities or making yourself more prone. So if you can have it all in one setting, that goes for adults as well. Cokes, juice, and then just drinking more water, plenty of water, and then flossing. Make sure you're flossing once a day. I always tell the kids not the floss dance, the real deal.
Not the dance, but the actual.
The real deal, and that can be translated into adults helping prevent periodontal gum disease as well.
Okay, as far as health goes for your teeth, are there any diets other than avoiding candy and those kind of things? Any nutrients they need to make sure they get in a regular diet?
So I always tell the parents that come in, obviously the candy is probably not the best choice, but anything like nuts, cheese, I always even recommend, a small piece of chocolate. That's much easier to clean off the teeth than, Sour Patch Kids or gummies. And milk is good, but when you start adding, chocolate milk, Hershey syrup, I like it. But, the more sugar that you add, just on down the line, it increases the chance for cavities.
Makes sense. Well, usually at this point, we have a couple questions from audience members and things like that. I have a personal question that I want to throw in before then, which is we talked about sugary drinks. We didn't talk about coffee, which as an anesthesiologist is near and dear to my heart personally. So from a recommendation standpoint, it does not have any artificial sweetener or sugar, but I'm not going to lie, I pretty much drink it all day. Is that a bad thing, or what are your thoughts on coffee?
Coffee is fine for the teeth. The only thing that you may notice is staining over time. Same thing with tea, which sweet tea does have sugar, but if you're drinking a lot of unsweet tea or coffee, staining is probably the #1 side effect that you would get, but it can always be fixed with over-the-counter whitening, Crest white strips, or going to your dentist to have a whitening.
Okay, perfect. Well, that's
You're in the clear.
Pretty good news. I'll take it. All right, wonderful. So one of the questions we got was, what made you choose pediatric dentistry over traditional dentistry?
So I originally always thought I wanted to be a veterinarian. I worked for a veterinarian office before I could even drive at 14. I have a really close family friend that is a pediatric dentist. She was always on me to come see her office. I finally did that when I was a senior in high school. Just my experiences at that time kind of drove me down the dental path. What really sealed the deal when I started going on mission trips overseas and here in the United States, just seeing all the kids that are in need. You know, I've seen kids with 20 out of 20 cavities. Just nothing is more gratifying to me, just taking a kid that may have been in pain and seeing them leave smiling ear to ear, knowing that they're not going to be in pain anymore, or fixing their teeth that maybe they were bullied about, and, you know, giving a thumbs up. So that kind of drove me down the career of pediatric dentistry.
That's
and
exciting.
As you know, not every kid is the same, so it's always a challenge every day. Not every kid's going to get up there in the chair and let you fix their teeth. You just got to come up with the right solution.
Well, it looks like you've gone on mission trips to Ecuador and those kind of places. Any difference you see specifically between kids in Ecuador versus in the United States, or other countries in general?
In other countries in general, and here, I mean, the caries rate when I was in rural Pennsylvania, it was pretty similar to Ecuador. It's just, you know, poverty sometimes will increase the risk of cavities, and just seeing 20 out of 20 cavities. I've seen it here in the United States. I've seen it in Ecuador. Even with the language barrier, at the end of the day, you know, the parent, it's just the relationship that you have with the parent and the kid, and they just are all so grateful that you can provide a service and help them.
That's awesome. Well, the next question we have is, since you have probably pulled a lot of kids' teeth, what method do you recommend? Well, you want to go with that one?
So we do see that a lot of the times. The kids just have that tooth that's holding on by a thread. They want to get it out on their own. So my recommendation, I see a lot of pulling, we say wiggle. And then we also, if you twist it like a light bulb, so push down and kind of twist. That's the key for the teeth here in front. I've also seen the Nerf gun trick.
Nerf gun trick. You want to go ahead and tell us that one? That's pretty exciting.
Tie a string to your little Nerf gun and shoot it, and the tooth will come right out. That's okay if the tooth's hanging on. One recommendation that a kid told me that I probably wouldn't recommend, they actually tied a string to their tooth with a brick and climbed a tree and dropped the brick off the tree. Probably wouldn't recommend that. We don't have to call the orthopedic surgeons for that.
Yeah, wow, yeah. That's
especially if the tooth is not loose.
Yeah.
That would not be good.
Yeah, you'd lose style points for that one probably. So
don't do everything you see on YouTube.
Yeah, okay, well, good to know. Good to know. Lastly, what's the one best thing that a parent can do for their kids' dental health?
So I think just starting early, developing a dental home is probably the best thing over time. That's going to be the best thing for the child. Now the recommendation is to start seeing the child by first tooth or first birthday. There are some thoughts out there like, man, that's really, really early. But if we can do education and prevention of dental cavities, the sooner the better. I mean, it's developing the relationship with the parent. Sometimes you just don't know. And so just focusing on, you know, setting that dental home up, starting, you know, the oral hygiene, dietary habits early, that goes a long way in life. And just having somewhere to call, especially at age 1, your child's up, moving around. So if they have a dental trauma, you may think, well, what do I do? At least you have a dental home. You can call somebody, call your dentist, and have them come in and help that child. So.
Yeah, that's great. That's great. Well, thanks so much for joining us. It's great to know your office is still open for emergencies and those kind of things to serve the community. That's awesome, and all the things you're doing to keep everybody, your staff and your patients safe. Also love the tips on drinking, you know, not all during the day, but potentially one time. So I think there's a lot of things that our viewers can use in their everyday practice to really help their dental health. So with that, I want to thank you guys for joining us today. Our future guests are going to include focusing on heart health. We're going to talk about pet health, spiritual health, a lot of different options out there. So we're going to be bringing that to you coming up. Again, I want to thank you guys for taking time to invest in your health, and you guys have a good rest of the day. Thanks so much.
Thank you.